different options for pain relief during labour. This includes gas and air, injections and epidurals. An epidural is a thin plastic tube inserted into the lower back that allows us to deliver medications to the nerves close to your spine. This is safe for both you and your baby. An epidural is inserted by an anaesthetic doctor. There is always an anaesthetist available on labour ward. However, when it is busy, there may be a short wait before you are able to have an epidural. Before the epidural is put in, the anaesthetist will have a chat with you about the procedure and the risks and benefits associated with an epidural. You will need to have a cannula, which is a plastic tube put into one of the veins in your hand, so we can give you fluids to keep you hydrated. You will also have basic monitoring to measure your blood pressure and heart rate. A midwife will also be monitoring your baby. To insert the epidural, we will ask you to sit on the edge of your bed with your feet on a chair, your chin on your chest and your back pushed out. We often use a pillow to help you get comfortable. If you have been using gas and air so far, you can continue to use this whilst the epidural is being put in. If you get a contraction while the anaesthetist is doing the epidural, it is important that you let them know so they can stop. It can take up to 20 minutes to put the epidural in. The first thing that you will feel is a cold spray on your back, which is an antiseptic solution to keep the area clean. The anaesthetist will then have a feel of the bones in your back and put some local anaesthetic in. This will sting at first for a few seconds, but will then go numb. The anaesthetist will then use a special needle to insert the epidural plastic tube. At this point, you may feel pushing or pressure, but not pain. You may feel a strange sensation down your legs, which is normal, but please let us know if you do. The epidural plastic tube will be left in, but there will be no needles left in your back, so it is safe to lie on it. The anaesthetist will then check that it has been inserted correctly and stick it down with lots of tape. You can then relax and move back into a position that you are more comfortable in. The epidural will be connected to a pump that contains the medication, and this will be delivered continuously. You will also be given a button that you can press to give you an extra dose of the medication if you start to feel pain, which is safe to use. It can take up to 20 minutes for the epidural to start working fully. Because the epidural can drop your blood pressure, we will measure it often after the epidural is put in. We will also insert a catheter into your bladder, as you may not be able to feel when you need to pass urine. You will only be able to drink water after the epidural is put in, but not eat or drink anything else. The epidural tube is taken out after your baby is born.
So epidurals usually work extremely well. It's not absolutely guaranteed though. About 85% of women get really good pain relief, and about 10% is adequate but not perfect. And about 1 in 20, which is 5%, actually it doesn't work. And that's usually because we haven't got the tip in quite the right place. In that situation, we can take it out and do it again, but we can discuss with you what the right option is for you at the time. There are some other potential problems with epidurals. The most common is that we drop your blood pressure a bit, and that's why we have the drip up beforehand. It's why we'll measure your blood pressure very closely after we put the epidural in. There is a slightly increased chance of having a forceps delivery with an epidural, but that's only a marginal increase, and we don't in fact have the chance of having a caesarean section. The risk of nerve injury is really small. About 1 in 80,000 may get some significant permanent nerve injury. and the risk of a temporary nerve injury is about 1 in 5,000. But to put that in some kind of context, the risk of a nerve injury after a normal vaginal delivery is about 1 in 1,000. Sometimes it'd be a bit tricky getting the epidural in, and on occasions people can develop a headache after an epidural. This may not develop for a couple of days, but it may be troublesome when it does happen, and occasionally we have to do something similar to an epidural to get rid of that headache. Occasionally people get a bit itchy, but that's usually mild. Sometimes people get an elevation in their temperature. That's not caused by infection, but we do watch very closely whenever anyone gets an elevation in their temperature, and that might slightly increase your chance of ending up requiring some antibiotics. Short-term backache is very common, and that's because of a little bit of bruising around the site of the epidural. But long-term backache, which is what people have often been concerned about, actually is no more common whether you do or you don't have an epidural. All told, epidurals provide the most effective form of analgesia in labour, and their risks are very small.